Good morning. I'm Dr. Paromita Sanatani. I'm a private practitioner and I'm practicing at Athena Eye Care, my private clinic at Goriahat, Kolkata, along with my husband, Dr. Supratik Sanatani. And today, I would like to talk about a subject which is very close to my heart, and that is squint. Now, normally, our eyes are completely aligned. No matter where we look, our eyes always move together, whether we're looking straight or to one side or to the other side or up and down, our eyes always move together. But sometimes this alignment is disrupted, and then it can lead to a condition which is known as squint or cross-eyed, or sometimes they may move out or be wall-eyed. Very rarely it can also move up and down, but that is much rarer and a more complicated sort of squint. Now, interestingly, sometimes squint is not permanent. Sometimes it's intermittent to begin with. That is, you look at the child and you think, is the child squinting? Are the eyes going in? And then you look again and the eyes are straight. Sometimes when the child is inattentive, maybe he's looking at the distance, maybe he's tired, and you think, is the eye moving out? And you ask the child, your eye is looking funny, and immediately it's straight again. So this is known as intermittent squint. Now, intermittent squints should never ever be neglected. If you have a doubt about whether the child has a squint or not, it is always necessary to take the child to a doctor. Because if you can treat the squint while it is still intermittent, it is very helpful. And these intermittent squints often go on to constant squints later. Now, there are a number of myths and superstitions regarding squint. One that is still prevalent today in Bengal, where I am, is that a little bit of squint is lucky. We call it Lokhi Tara, after the goddess Ma Lokhi, which is the goddess of wealth. But no squint is lucky or unlucky. Squint is squint. If you have even the slightest deviation in your child or in yourself, you must consult a doctor early. Now, another interesting thing is that squint is the outward manifestation of a variety of underlying conditions. So in that way, it's a lot like fever. Like you may have fever from malaria or you may have fever from typhoid. And the treatment for these two conditions are completely different. Similarly, not every squint is the same. Squint can occur due to a number of reasons. I will discuss some of the important reasons. Now, you can see that this is the eye and it has a number of muscles attached to it. These muscles are what come into play to move the eye. Normally, these muscles are perfectly balanced no matter which way we look. Supposing we want to look to our right, then this muscle will pull. It will contract to look to the right, but it is not enough for this muscle to pull. This muscle on the other side has to relax the exact same amount. And in the other eye, the muscle pulling this side has to contract the exact same amount and the other muscle has to relax the exact same amount. So this is a very delicate balance which has to be maintained in all directions of gaze. And sometimes this balance is disrupted and this can lead to squint. And this type of squint usually needs surgery. Sometimes squint can occur due to a high power. If a child is born with a high plus power, then sometimes in order to see, the child has to use the muscles, and the contraction of those muscles to see clearly leads to an inward deviation of squint. These types of squints are known as accommodative squints and they are corrected by glasses. They don't need surgery at all. Squint can also be caused by poor vision in one eye. So if you have a squint, it's necessary to examine fully to make sure that there isn't something wrong with one eye that is causing the squint. Squint can also occur due to a nerve paralysis. That can be due to an injury to the head. You have a motorcycle accident and you wake up from your unconsciousness with a squint due to a muscle. It can be due to diabetes. It can be due to hypertension followed by a stroke. It can sometimes be due to a brain tumor or a variety of underlying diseases. So what this means is that every squint patient needs to be investigated separately. They need to be seen multiple times sometimes, and you cannot expect any quick fix solutions. You cannot expect to walk in to a doctor and say, I have a squint, please correct it, and the next day they will give you glasses or perform a surgery and you'll be fine. You need, the surgeon needs to see which muscle to operate. Do you need an operation at all? If you do, which muscle do you operate? How much do you operate? So don't expect a quick fix solution for squints. There's also another misconception that squint is basically cosmetic. In fact, it is far from the truth. Squint is not it is not only a cosmetic disease. I'll give you 3 reasons why. Firstly, there's a thing called binocular single vision. When we're looking at something, we are using both our eyes to look at that object. So both our eyes are telling us that the object is in front of us and there is no confusion, and the brain merges the images from both these eyes into one single image. If one eye squints, then the inputs from the 2 different eyes are different. They are looking at 2 different objects. This causes double vision or confusion in the brain, and there is no binocular single vision. Secondly, if one eye is always squinting, then that eye is giving us a false image and the brain will shut it off. This will lead to amblyopia, or what is known in layman's term as lazy eye. And thirdly, squint is often a manifestation of an underlying disease. So squint must be corrected. It is not corrected only for cosmetic reasons. It is corrected for functional reasons. So don't ignore a squint. Go early rather than late. Which brings me to my last point. How early should you go? A child is often born with a slight deviation of the eyes. You think maybe it's a little off. You're not very sure. Do you go immediately? Do you wait? You go immediately if there is a large angle constant squint. The child is born with crossed eyes, it's always there. Go immediately. The child is born premature, low birth weight, or with some underlying disease. Get an eye checkup immediately. Or if there is a squint associated with a white reflex in the eye, or it looks like there's a cat's eye reflex from the inside of the eye, similar to what we see in the cat's eye in the dark, something glowing. Never ever ignore these. But otherwise, small children are often born with a little bit of misalignment, and you can wait for 3 or 4 months. If the eyes are not aligned by then, definitely you must seek consultation with a squint specialist. So I hope I have been able to demystify some of the things related to squint, and I would like to close with the closing message that squint can be treated. Most squints can be treated. And if you have a squint, or if anyone you know has a squint, go early rather than late. Thank you.